how to save small medical practices from economic fallout on today's Medical Economics Pulse.
I would implore anyone who's listening to this, be much more creative. Take everything into consideration. Don't just look at where you can access capital, but take a look at your revenue, take a look at your expenses, talk to your insurers. And these are the things you're not just going to assess like you would normally do monthly or weekly. These are things you have to look at every single day. I really do believe that the businesses, the practices that are on top of this are going to be sustainable, and the practices that really just think we're going to get back to business as normal once this is over aren't going to be around in the future.
The COVID-19 pandemic has turned the world upside down, and medical practices are caught in the middle of it. Physicians must do what they can to treat their patients while also collecting enough revenue to keep their doors open. So what can physicians do to confront these challenges? Today, we are joined by Dr. Halee Fischer-Wright, the president and CEO of the Medical Group Management Association, to discuss how practices can weather this unprecedented storm. Dr. Halee Fischer-Wright, thanks very much for joining us today.
Well, thank you, Chris. I appreciate the invite.
So the first thing I wanted to go over is just, at MGMA, what are you guys hearing from physicians and medical practices about how the pandemic is affecting them?
Yeah, I think so. Number 1, 2, 3, up to 27 thing we're hearing is what people didn't anticipate was the drop in volume. So every single medical practice is experiencing a drop in volume. Some of them are even experiencing volume drops 70 to 90%. So primary care, we're seeing drops 50 to 75%, but in specialty, for example, GI, or some of the surgical subspecialties that are not in the elective but necessary category, down to 90% of volume.
Wow.
And then
with
that decrease in volume comes with it, not surprisingly, massive concern for need for cash to run the businesses.
Okay. What is there anything that MGMA is doing? Obviously, this is a huge global and national issue, pandemic.
Yeah.
What is MGMA doing to try to help practices deal with the strain that they're under right now?
Yeah, I mean, I'm very proud to say we're I would say one of the national leaders in thought leadership around how this crisis has hit medical practices and the things to do. So if your listeners want to go to the mgma.com website, what you'll see is quite a bit of material under the COVID-19 Action Center. So we have an action center that handles the regulatory components of things that need to happen. So certainly even before that CARES Act, that $2.2 trillion stimulus bill, there was a preceding bill that talked about things that they can do decreasing administrative burden. And we have all the resources around that allowed. If you're a practice that takes Medicare or Medicaid, you could get paid immediately, do attestations for delivery of care. It also decreased certain reporting need as well that were not necessary in this right now. Under the CARES Act, we have quite a bit of information. What we're seeing is practices that are 500 FTE have a different access through the Small Business Association to have a different access to capital than practices above 500 FTE. And so there's quite a bit of information that we have because we bifurcated those two practices. But what we see is that for as much as we're talking about the federal government supporting practices, there's also just the flat out business needs of the practice. And so under our Action Center, we have a whole list of what I consider exceptional resources on how you set your practice up for telehealth, how you set your practice up to talk to insurers, how you set yourself up with your constituency and your patients, what are best practices. So no, we're not going to bring practice people into the office, but there are chronic disease patients that still need to have contact from the office. And so how do we set that up? We also know that this is not a forever thing. So we also need to start thinking about what happens 2 weeks from now, 4 weeks from now, 6 weeks from now. How are we going to get those patient volumes in a safe way that that allows our staff to come back as well?
So, in terms of the CARES Act and some of the financial help that's out there
Yeah.
for practices, what are you hearing from practices and from medical groups? Are they actually been able to access this money? I know there's been a lot of media reports about how obviously there's a huge demand and that it's been tough for different businesses and industries to
Yeah.
access this. What are you hearing from sort of your members in terms of being able to actually get the relief that they're looking for?
Sure. So one of the pieces of advice that we gave our members is when the nanosecond that program opens, get your paperwork in. Because we knew that it was a finite resource and we were competing under the SBA loan provisions under CARES Act with everything else out there that's a small business that wanted to apply for that. So for our practices that applied early, they have had notification. There were practices that may have wanted to basically take 5 days. They didn't get that stimulus money. Now, thankfully, sometime today, the House is going to vote on the second provision that is really healthcare and orientation and refunding the SBA program. So for anyone listening, get your financial house in order. If you're going to apply for the SBA loans, get it in now. Get in line. And then the other part is we had practices because they were over, as I mentioned, 500 FTE that needed cash infusion. So we helped to work with them. They didn't have access to capital through the SBA provisions in the CARES Act. They may have access to capital through some of the programs through CMS and HHS. So the idea is we want to get them inflow of capital to sustain themselves until we get to that next round of what are the business needs of healthcare in the United States.
Okay, so in terms of obviously like practices are looking for that relief from the government,
Yeah.
but in terms of just being able to, you had mentioned telehealth, just being able to sort of keep your doors open, make sure you can still see patients with chronic conditions, those things. Can you talk a little bit about telehealth getting started? You know, a lot of physicians before this crisis weren't necessarily ready. So what should you do if you're in that position and you want to get started quickly with telehealth?
So like we said, go to mgma.com, look at our COVID, because we have some just super simple, this is what you need for telehealth. You can get started an hour from now. I think we had, prior to COVID, had all assumed that getting started on telehealth would be huge and cumbersome. And honestly, the barrier for the last 11 years hasn't been technology or security. The barrier has been compensation. So if I spend, as a physician, like myself, if I spend 15 minutes with you on a phone, I'm not going to get compensated like I would seeing 15 minutes as a patient. So there was no impetus to push people into telehealth unless you were in rural areas or, for example, neurologists basically covering large regions. That all changed. Funding under that first provisional bill that went through Congress changed how HHS, CMS funded, reimbursed under Medicare for telehealth. And likewise, insurers have followed suit. So now the compensation issues have been, I won't say they're perfect, but substantially better than they were 2 months ago. And so now we see people in large medical practices that have 5 different telehealth systems. They're using Zoom and Skype and several of the more sophisticated telehealth programs that are out there. You can do it on FaceTime, provided that you use the appropriate documentation. Now, I do think as we go through the summer, we're going to see ratcheting down documentation security change. But today, it's not, there's the only barrier for telehealth is actually providing the appropriate documentation. So I would like to encourage any practice, if you haven't dipped your toe in that, it's actually right now, it's so easy to get in, you're just losing revenue if you're not. And we're seeing, I was on a webinar, led a webinar yesterday, we're seeing practices use telehealth for even routine physicals, even, believe it or not, woman exams. As if you don't need a medical procedure like vaccines or something like that, you can actually use telehealth. Now, it doesn't take the place of we won't see you for a year. Then we say, okay, we'll need you to come in to do the physical exam component. But so much that happens in well-care, and so much happens with a physician or a provider interaction that can occur during telehealth to just through this limited time period, 6, 8, 12 weeks, that we can do that online and still maintain good health as we move forward as a country.
Okay, great. Obviously, you had mentioned patients with chronic conditions, and
Yes.
keeping tabs on those patients is obviously extremely important, especially for the primary care doctors who are sort
Yeah.
of the quarterback of care for these patients.
Yeah.
What advice do you have for how, obviously telehealth is one option, but how can and how should physicians and other providers and practices sort of make sure that these patients are cared for to the level that they need to be, despite the pandemic?
Absolutely. I think once again, I'm going to point your listeners to our resource center because we have best practices, and these are not best practices in care because of COVID. These are just best practices in maintaining patients with chronic care. There's a lot of opportunities, a lot of things that are we can use telephonically. We can use. We can even. I hate to be old school. We can send a postcard with a stamp that says, "Have you checked your blood pressure? Are you following, your diet? How much insulin are you on? How much oxygen are you taking? Are you doing your inhalers?" I mean, think about, are you taking your high blood pressure meds? We can use pharmacies to notify us if we can have that type of communication that people are not picking up their routine medication, and then that triggers us to follow up and take care of those people. One of my bigger concerns as we take a look at the landscape of delivery of healthcare, and this is part of the business of healthcare, is to make sure we all want cost-effective, high-quality, patient-satisfying care. But the thing to note is during this time period where we've put everything on pause, people still maintain their chronic illness. So we want to make sure that we're implementing the systems that will keep in touch with those chronic disease patients and keep them stable during this time period, so that not only when we get out of this are we going to navigate a second curve of COVID disease in the fall, but we don't want a wave of worsening chronic disease as we get through the end of this as well.
Okay. In terms of staff, obviously this
Yes.
is a difficult time for staff as well.
Yeah.
What advice do you have for both, whether it's a physician owner or a practice owner, management of a practice or medical
Yeah.
group? What advice do you have for how to sort of keep staff morale high? How do you because it's such a strange time for everyone.
Yeah.
How do you sort of manage that and sort of the leadership techniques you need to do to kind of help your staff through this time?
Absolutely. So I think about it in terms of Maslow's hierarchy. It's hard to talk about being self-actualized, like, are we happy and fulfilled and living with purpose, if you're not sure you're going to have a job. So you have to have those conversations right up front. Do you feel safe and secure? And I think it's the leader's responsibility, be it a leader of a national organization or a leader of a small independent practice, to create that sense of security. That sense of security may not be, hey, everything's going to be okay. That's disingenuous. But it is fair to say, here's what I'm thinking, here's what we're working on, this is how I see things playing out. And I know several practices have furloughed staff members. They've been very honest with them. We want to keep staff. We want to do this. This is what we need to do. It's a finite period of time. These are the things we can do to help you out. For the staff that are remaining, these are what the stakes are. And so everyone is working together. And I think it's actually very different than we usually do in healthcare. That's very hierarchical. I tell you what to do because I'm the doctor. This is where I think a physician has to be a team player and really has to be connected and authentic and work well within the team. I think a lot of practices are going to come out of this stronger and more resolute and more clear on what their roles are and how important their roles are in healthcare. And I think some practices aren't going to make it because of those leadership fundamentals.
Yeah, and in terms of, speaking of practices not making it, obviously we're hearing a ton from our audience, and
Yeah.
there's a lot of fear out there right now.
Yes.
And I think especially when it comes to the independent practices, there's already been that trend of independent practices dwindling and more hospital-owned practices. And I'm just wondering, what do you think it would be the impact? I mean, independent practices are still a huge part of healthcare today. And I'm just wondering, from your perspective in MGMA, what do you think is sort of like the impact of sort of losing the independent practices that are out there?
Well, so independent practices still make up 40% of the medical practices in the United States. I actually think so I navigate two schools of thought. One, hospitals and large, finances are going to own everybody. I actually think this situation is going to pull things in the opposite direction. And the reason why is, all things being equal, the medical practice is the most cost-effective point of delivering care. Now, that doesn't mean getting patients in. It can be through telehealth, it can be using home health. I'm just saying there's alternative models. What we know is the hospital is the most expensive place to deliver care, right? We've seen this crisis adversely affect hospitals in a certain way at equally proportional as it's affected medical practices. And that's because the elective volume was utterly taken out from underneath them, and that's the source of their revenue. So I think it's going to take several years for hospitals to recoup their losses. So do I think there's going to be an appetite to buy medical practices right now? I don't. Now, interestingly, 2018, 2019, we saw a real slowdown in hospitals purchasing medical practices and an increase in alternative legal structures such as joint ventures, some limited liability partnerships, and then we also saw private equity entering it. What I think we'll see is the rise of more practices. Now, do I think it's the independent practice that most people think about, 4 or 5 doctor, the MGMA statistic is 6 full-time physicians in a practice? No, I suspect they'll be bigger. I suspect they'll be different. And I suspect there'll be quite a bit more telehealth in that time period. But I don't see, at least for the near future, I don't see hospitals coming in to save medical practices and be an alternative form of employment, because I think they're having to navigate their own sustainability right now.
Okay, and sort of a follow-up, in terms of, sort of saving medical practices, whether it's a small independent or a large group, what more needs to be done? I know there's been a bunch of, programs, we mentioned the CARES Act already.
Yeah.
But what more do you think needs to be done to try to, throw a life preserver to medical practices?
Well, one of the points that we always talk about at MGMA is we need to really take a look at the work of a medical practice. 30% of it is probably what we consider administrative burden. You could just cut that out. It wouldn't impact care, and it's just costs that we have layered on. I think this is really the time to take a look at what are the things we're doing in a medical practice that don't add value and don't improve patient care and just add costs. So this is, I think, a great opportunity to do that. Second is, as I keep kind of poking on, is access to capital. So in addition to looking at the federal government for supporting, we also need to look at insurers. Quietly during this time period, United Healthcare reported their profitability and other insurance have reported their profitability. So I think this is an opportunity where insurers in the environment need to participate in how do we sustain those medical practices that are integral to their function as well. And then the other thing is we need the business community to really step up and open access to capital to medical practices, leverage the, right now, the availability of getting capital is so low, it's practically free. And so as the banks get that, I'd like to see programs with the banks themselves that have reduced interest rate loans, at least for a short period of time, to medical practices that demonstrate good business practices that are good risk. They kind of have to be in that 750 credit line and above, but I'd like to see independent federal loan programs. I'd like to see banks start to take initiatives to support healthcare practices as well.
What do you, is there, obviously this is an extremely challenging time. Is there anything sort of that we can learn from or take from this this crisis that will actually improve the way we deliver care and the way we run our practices going forward?
Yeah, so I always look at the mantra at MGMA is never let a good crisis go to waste, right? And I don't think it's any secret to the people that you've interviewed or the people I speak to. There's so much we do because we've always done it. And we keep layering on kind of layer and layer stuff that we do without stripping out and really taking a look at what is the basic functionality that we need to do. So I think this gives us a real good opportunity to take an assessment of what do we need to deliver care. And we also need to, and this is the other thing that I write extensively about, really embrace the fact that medicine is a business and that we, as for the independent practices, we are responsible for running a business. And so we have to start to approach things on, does this make sense? So in the same mouth that I say access to capital, it also has to intuitively make sense that you have a sustainable business model. I just want to see patients is probably not going to be a mantra that is going to be sustainable past 2021. I'm a small, medium business owner. If you have a large practice that's generating over 250 million in revenue, which we see pretty commonly. I'm a medium business owner, one of several, I assume, and these are what my needs are. To have that clarity that you're in the personal service business, I think is going to be very helpful moving forward. And I think it takes the ethical sting of what you're doing is creating sustainability so that you can serve your constituency of your patients.
Is there anything that we haven't talked about in terms of the finances of practices and sort of the challenges right now that you think it's important for physicians and practice owners to know about?
Yeah, I actually think it's so, what is happening right now, you can see that I'm working from home. I haven't been to my office in 6 weeks. My state has a hardcore lockdown. And the thing is, this opens the opportunity to really rethink your entire business practice. So on one hand, I think as we look at the lay press, we're only talking about the CARES Act and funding to go to hospitals and those kind of things. But I would implore anyone who's listening to this, be much more creative. Take everything into consideration. Don't just look at where you can access capital, but take a look at your revenue, take a look at your expenses, talk to your insurers. And these are the things you're not just going to assess like you would normally do monthly or weekly. These are things you have to look at every single day. I really do believe that the businesses, the practices that are on top of this are going to be sustainable, and the practices that really just think we're going to get back to business as normal once this is over aren't going to be around in the future.
Dr. Fischer-Wright, thank you very much for joining us today.
Thank you, Chris.